I'm Jim Clyne, the president and CEO of LeadingAge New York. We have extensive testimony because we represent the full continuum of care in New York State, from nursing homes, home care, assisted living, and managed long-term care. I can't get into my testimony without addressing the first testimony. The only thing that was correct in his testimony was that we are largely funded by the government. Other than that, it was fiction. The Long-Term Care Coordinating Council is essentially a front group for trial lawyers. Go to their website. The chair of their board makes her living suing nursing homes. So obviously they have a negative view of the care being provided. With that said, I'd like to deal with some actual facts. As Stephen said, the state has the worst Medicaid rate when you compare the cost of care with the Medicaid reimbursement. 15 years of unfunding. If you look at the charts on page 5 and 6 of my testimony, you'll see that we've also gotten no investments, or nearly no investments, from the Medicaid waiver programs or from the transition pools. Nothing like what the percentage of Medicaid we are in the state. Without the significant investment, you are not going to see new beds open up. There's 6,600 closed nursing home beds, closed as in not staffed. They're legally to be open, but we can't find the staff. That's 6,600 more than in 2019. That's why you're seeing backups in hospitals. Hospital emergency rooms are being affected, not only because they don't have the staff they need, but they can't get people up into the rooms because they can't get people out of the rooms to the nursing homes. So the underinvestment in long-term care is now affecting the entire healthcare system. A 20% increase would be half of what the nursing home should be being paid if we had had a COLA for the previous 15 years. The ultimate solution is to rebase the system. That means move up to a year that is closer to what's actually going on as far as the cost of providing care and who is providing the care. By rebasing the system, you get a more accurate reflection of the costs and which individual facilities were providing the care. The other area I just wanted to touch on is a proposal in the governor's budget for medtechs that would allow CNAs to provide medications. It's something that goes on in the OPWDD system right now. It's something that can be done safely, and it would really take the burden off nurses from having to pass meds and allow them to do the nursing skills that we desperately need in our facilities. Be happy to take any questions.
Thank you. We go to Senator Rivera.
Now, Jim, you said at the beginning of your testimony, I just want to make sure I also understand that. So you said there was a fiction. You were referring to the testimony of this gentleman before you? Or?
No, the Long-Term Care Coordinating Council, which is the front group for trial lawyers. Okay. They're not patient advocates, just so you know.
Thank you. We go to Assemblywoman Paulin.
Thank you, Madam Chair. Welcome back. Thank you. So I wonder if you mentioned rebasing. Do you have any specifics, or a certain way of doing it? There's lots of ways.
Yeah, it's a complicated process, and it would be great if the department would set up a work group to work on it, that everybody could have a chance. Right now, the statute already states that the state should be rebasing periodically. Certainly 15 years is not periodically. We're going to work on some language that would try to put some parameters around rebasing. Most other states do it every 5 years in order to catch up the cost and also sort out where the money goes for the appropriate providers.
Thank you. And to your knowledge, have there been any nursing homes cited for lack of safe staffing?
Based on the 3.5 or the new laws that are in place, the Department of Health is still promulgating the regulations. We're waiting for the final regulations.
That's it for me. Thank you.
That's an interesting point, though. I just want to give you one other point. So the 4070 law already requires the spending on resident-facing care and direct care staff. So that's already the law. 90+% of my members meet that statute, yet 57% of them cannot get to the 3.5 hours.
Yes.
And it's because the rate is too low. So even when we're doing 70-40, like you requested, again, 90% of my members, they can't hit the 3.5 hour mark because there's just not enough money. Medicaid pays for 70% of the care.
I would just ask one more question as a follow-up. The 20% increase in Medicaid, would that open the 6,000 beds that we're talking about?
That would open beds.
Absolutely.
That's why again, the 5%, it's a start, but it is not going to have an impact on the level. I mean, there are waiting lists. I have a member in Westchester, 65 calls a day looking for placements.
We did hear today that the money for safe staffing is supposed to still go out the door, so that was good news.
That was,
If they'd actually do it. Now, just remember, trust but verify or something like that. The money that you appropriated in 21-22 never went out.
that's correct.
So the money now, they're going to say it's going to go out in the last 30
So are you
days.
really saying the 5% is less than
It's
that?
2%. If the 187 goes out, then it's not a 5% increase, it's a 2% increase.
Right.
Just for nursing homes. And just to expand, there's 614 skilled nursing facilities in the state of New York. When the data is run, 75% of those cannot meet the 3.5 staffing requirement.
Thank you. We go to Assemblyman Jensen.
2 years ago, and then we amended it last year, we created a reimagining long-term care task force. That entity was supposed to, the effective date was the beginning of December. Are either of you aware of either the co-chairs? I wish I would have had a chance to ask the commissioner earlier, whether it's the commissioner of health or the director of Office for the Aging, an understanding of when that task force may begin its statutory work.
I'm a member. I was appointed a member of that. I've gone through the background check. I've not received any information as to when the first meeting will be.
Do you think that in listening to the statutory stakeholders that are supposed to be part of that task force, it's important for it to begin its work, to begin providing recommendations to the legislature and the governor on the ways to move our long-term care ecosystem forward into the 21st century?
I would say absolutely. As Jim mentioned, from rebasing to staffing, the whole spectrum of issues facing long-term care in New York need to be dealt with in a holistic way and not a siloed way. And I think that committee is the vehicle to do that. So I think that it's appropriate to move forward on that as soon as possible.
And the governor also has the master plan on aging going on, but they're not looking at the long-term care system specifically. So unless this other group is going to look at it, then nobody's going to be.
And I'm anticipating some more questions on the Medicaid reimbursement rate increase. But I do want to point out that I think it was last week, the progressive bastion that is the South Dakota State House of Representatives did pass legislation mandating that their state would have 100% nursing home reimbursement, and that it would still not cover the cost of care in that state. So certainly, while other states are choosing to make that investment, certainly we should take the time in New York State to fix the failings of a generation and ensure that we can actually have the cost of care covered for some of our most vulnerable residents.
Yes, in the middle of COVID, remember, we took a 1.5% cut when every other state was investing.
Thank you both.
Thank you. We go to Assemblyman Gandolfo.
Thank you, Madam Chair, and thank you all for being here and providing your testimony. So we heard a lot about staffing issues at our nursing homes and long-term care facilities. If med techs were introduced to nursing homes, what kind of impact would that have on care and staffing in these facilities?
I think it would not impact care at all. Again, in the OPWDD system, it's been going on for 50 years. You certainly have to train the CNAs, and they have to work under the supervision of a nurse. But what it does is it takes an easier task of passing medications away from the nurse and allows the nurse to spend more time on things like assessment that only a nurse can do.
We go to Assemblywoman Jen Lunsford.
Thank you. This question is, I guess, for Stephen and Jim. When we look at the 5%, there are many ways that that's reduced, whether it's the 187,000 for dealing with our county-run nursing homes, the 340B issues, the EF-MAP issues, or further reduce that. I wanted to give you an opportunity to discuss the difference in the solvency and quality of care in our nursing homes if they received the 5% versus the 20% Medicaid increase?
I think the 5% would certainly provide some stability. I still think there would be some closures of not-for-profit homes. We've had 50 homes close or be sold. We're rapidly moving to a system without not-for-profit care, but certainly the staffing, you would have a better chance of meeting the 3.5-hour requirement. With that 5%, I'm not convinced the 5% would actually get us there. And again, I think there's some confusion. Again, Medicaid is the overall payer. Medicare is the next biggest payer. The government totally controls what we get. There is no place to cost shift. There is no place to get money from somewhere else. There's no ability to shut down your services. It's 24/7 taking care of people. So the only thing we can go back on is taking beds offline.
So we are certainly talking about not just a matter of increased care, but at 20%, we could bring beds back online.
Yeah.
And at 5%, we are still going to continue to lose beds off the 6,600 we currently
Because the
lost.
first priority is going to be hit the 3.5 staffing hour requirement.
All right. Thank you very much. That's all I have.
Thank you.